Hi, Dr. Lopez.
Hello.
Can you hear me? Right. Hi, Jackie.
Hi, Jack.
Hi, everybody.
Hi, Jen.
Jennifer.
How we doing?
Good, good.
Jerry.
Hi, everyone.
Hi, Jerry.
Hi, how are you?
Good. How are you?
Here I am. Let's see.
Hi, Carrie.
How are you?
I'm good.
Why can't I? Oh, there it is. Hi, Rick. How are you?
Hey, Gary.
Nice to see you. Hi, Jackie.
Jerry.
Hey, Jerry. How are you?
Good.
Hi. Are you Jennifer or Jen? Jen. You're Jen?
It both is fine. I'm not very picky.
Nice to see you.
Nice to see you.
Hi, Robin. How are you?
Hi, doing fine, thanks.
Great.
Was Paula going to come to this meeting, or she has a conflict?
Well, I won't be at the meeting tonight, and Kevin is going to be a few minutes late. He will be joining us at 7:15, I believe.
Okay. Okay, then maybe we should go ahead and get started. Since we have a quorum and I don't want to wait too long. So I'd like to call the meeting to order. And in terms of tonight's agenda, we're going to start with the minutes of April 7th for review and approval. We then have a variance request for the number of chickens on a property with Robin's request. Then we'll move to the Hartshorn Street request for an extension of time for compliance. We have the body art apprentice program proposal to review. Kevin will give us an update on the coalition if there is one, and then Ade and Jennifer, the health department monthly report. And we'll do public comment and we'll wrap up. So that's the plan for tonight. In terms of, let me ask, in terms of the library presentation on May 12th, there wasn't a quorum at that meeting, so there were no minutes to approve. Is that correct?
Correct.
Okay.
Correct.
Okay. And then in terms of the minutes for April 7th, look fine to me. Thank you, Jackie. Okay with you, Carrie?
Yes, no issues.
No issues. Okay.
They look great.
I'll second the motion. Roll call, Carrie.
Yes.
Rick, yes. Minutes are approved. Okay. So I'm going to turn it over to Ade to kind of set the context, introduce Robin, and kind of go from there.
All right. Good evening, members of the board and the general public. So in 2021, last year, Robin and Jason requested a variance to increase the total number of chickens on their property to 9. The keeping of animals regulation only allows for 6 chickens to be kept on a property. They went ahead and added 3 more chickens, thinking their variance request was approved by the board. Apparently, their variance request was never reviewed by the board. It was not approved either. They are here today for a formal approval of their request. Robin is here, and I believe her husband is here as well.
Yeah, he's
The neighbors have been notified about their intentions. The property has been inspected by our animal inspector, who stated in a letter dated July 29th, 2021, that there was no reason to deny the variance request. The animal inspector further stated that the chicken coop was well maintained and the food storage and manure management plans were sufficient. My recommendation to the board would be to move to approve their request. Robin, would you like to say a word or two?
no, that sounds exactly right. We had when we received our chickens from our original order, we had 3 extra chickens included with our in our box, and we just kept them and maintained them. We did attempt to get the permit amended last July, and then I spoke with Peter Morandi in October. We had been on the agenda, and then he called and said that he was going to remove us because it was 3 chickens in the backyard and you had COVID and other things to worry about, and just indicated that it would be processed later. And so here we are.
And truth be told, I vaguely remember on a phone call with Peter, I think last fall, going through a few things, that he mentioned this as well, that the 3 extra chickens, probably a bonus or something, 3 extra chickens, and he didn't think it was a major issue. And obviously, maybe I wasn't sure of the process that it required a board approval. And he, as Robin said, just kind of let it go. In any case, it's better that we formally review these things and approve it. So I can sort of concur with Robin's story.
Yeah, sounds like, unfortunately, transitions tend to, tend to kind of make things a little complicated. And I think you had the good fortune of being right in, following up with us right at a transition. So thank you for following up, and thanks, Ade, for bringing this up to us.
And so I'd make a motion to approve the variance of the additional 3 chickens.
Second.
Second. Roll call. Carrie?
Yes.
Rick? Yes. It's approved. Robin, you're all set.
Excellent. Thank you.
Thank you very much for coming.
Is there anything else we need to do?
Ade?
At this moment, no. We will just amend your permit to say 9 instead of 6. That's pretty much it, and you'll get your regular inspections
Okay.
every year. So feel free to stay for the entire meeting, or you can leave if you.
Okay, I think we'll leave, but thank you very much. Nice to meet you, but we'll let you do your thing now.
All right.
Good night,
Thank you.
everyone.
Good night.
Good night.
Good night.
All right. 34 Hatshorn.
Yes.
So Michelle and Brian, I don't believe they're here today, but they are requesting a variance to extend their compliance time. They have requested more time to go through the rubbish and garbage in their yard and to get the structural issues repaired. I'll go ahead and give a quick timeline of events that would help the board make their decision tonight. On March 7th, 2022, we got an email complaint from a neighbor about rat infestation at 34 Hatshorn. On March 14th, about a week later, we did a walkthrough of the exterior of the property. I was there, Health Inspector Jen was there, Fire Captain Nelson was there, Building Inspector Brett was there. The senior case manager, that's Valerie, she was there, and Elise, the nurse advocate, was there as well. The violations we observed from the environmental health side of things, we observed rodent tracks in the backyard. we observed multiple burrows around the foundation. We observed excessive garbage and rubbish, creating rodent harborage, structural damage to foundation, and fence on the property. On March 24th, we sent out a certified order to correct letter, pretty much a notice of non-compliance to the property owners, informing them of the violations that we observed and giving them a compliance time to get the violations rectified. On April 1st, 2022, we received a pest control abatement report from Waltham Pest Services. 4 days later, April 4th, Waltham Pest Services returned to the property to do a follow-up inspection. On April 26th, the owners applied for a dumpster permit with the town of Reading. April 29th, the dumpster was delivered to their driveway. And on May 3rd, there was a second walkthrough of the exterior of the property. At that time, the homeowner requested a time extension, for the cleanup and removal of the garbage and rubbish on their property. Let's see, we've scheduled a follow-up inspection for May 26th. Let's see. So from my understanding, it appears that the property owners are being responsive. They're getting dumpsters. We have Waltham Pest Control. So they're doing something. They're not just sitting and not doing anything. So I believe they are being responsive, and I recommend giving them more time to have these violations abated. And I believe an extension of no more than 30 days should be sufficient.
Do you have a sense that they can complete the corrections, the fence, the foundation, the cleaning? Do you think they could do that in 30 days? Do they think they can do it in 30 days? How about that?
I believe so. I mean, this has been going on for a while. We have some of the neighbors helping out as well. So I believe 30 days is more than generous.
Okay.
So,
And was it your sense when there was the walkthrough on the 3rd, you saw that there had been some progress made? Indications of efforts is what you said, yes?
absolutely. And I would let Jennifer comment on some of our observations as well.
Okay.
Yeah, the walkthrough that was completed on the 3rd, there was much improvement. Some things were moved from side to side, but everything seemed to have a direction of where it was going to go eventually. And it was only a couple days after the dumpster had arrived, so the sorting had started to take place at that time. But yes, there was definitely plans and wheels in motion.
And so so there's follow-up for 526 and the extension goes, so sorry, what's the date, I guess?
Well, just my recommendation is no more than 30 days.
Okay.
When Waltham Pest, I read their report, and they had set some traps and had retrieved 4 dead mice and saw that there was some feeding of rats. Do we have a sense now that the traps and poison that they set have gotten rid of the rats, or do we think it's still an active problem?
I believe it's still an active problem, and it's going to take a while to get the problem taken care of. It's not something that will be taken care of like right away. They are moving towards, they're moving in the right direction, but.
Okay. So just to be clear, 30 days would be June 19th. Is that what we're thinking that, let me take a look here. That's a Sunday. So maybe we can do June 20th, which is Monday. So I would make a motion to provide the extension to June 20th. Second? Carrie?
Second, yes, I have a question, just a clarifying
Oh,
question.
go ahead.
So the extension is inclusive of repair of the issues noted with the fence and the foundation, as well as cleaning up the materials in the property, right?
Correct.
Okay. And so on the 20th, at that point, you'd conduct another walkthrough and you would,
So once
Yeah.
we conduct another walkthrough on the 20th and the violations are not corrected, then we will start looking at the option to go to court.
but right now you're seeing good faith efforts to address all of the issues at hand.
Absolutely.
And so the extension is warranted. Got it. Okay.
Correct.
No other questions.
Okay.
Okay.
In that case, I think we have a motion and a second, so roll call. Carrie?
Yes.
Rick, yes. So the extension is approved to June 20th. Great. Moving on to body arts, I think.
Okay. So at the last meeting, we talked about amending the body art regulation to include an apprenticeship program that will allow individuals to complete the 2 years of experience required to practice as a body art practitioner within the town of Reading. If the board is fine with the way the language is written, I can send it to town council for legal review. And once I get it back from the town council, I can present it again at the next Board of Health meeting for a board vote. So that meeting will be on June 2nd.
So I had just two comments on the guidelines. One is sort of practical, which I don't know if you've discussed it with the people at the tattoo parlors, but is there any advantage, at least for the business, to have more than one supervisor for the apprentice, maybe two, because if it's one-on-one, then it requires that supervisor to always be the person who's there. For 2 years, they always have to sync up their schedules. I mean, it's a convenience thing, not critical, but that was one potential addition. I'd be interested in thoughts on that. And then go ahead.
Just to quickly comment on that, yes, it's for 2 years, but they only have to complete 1,800 apprenticeship hours.
Right, and 900 is, the first 900, the supervisor has to be physically present.
Correct.
And the second 900, they have to be on the premise.
Correct.
Yeah.
So if we look at 900 hours, let me do the calculation. 900 divided by,
It's
so
about
we're 112 days.
Yeah.
Out of 365 days.
Right. I think I counted, it would be something like 18 hours a week. One would have to be there. It's not critical. And I suppose if the businesses did not raise it as a concern, I'm not too worried. I had one other suggestion, which is having one of the requirements be that the apprentice read and attest to reading these health regulations on, for the body art establishment practitioners. It just seems like that would be a good educational thing for them to have gone through it and read it to get the big picture, and just to attest to it. I don't think we have to test them on it, but I would suggest that as maybe an addition.
I agree.
Okay.
I agree with that. And just Rick, my memory from our conversation with this group, was it last month? It feels like a long time ago, I think there was a day, correct me if I'm wrong, the apprenticeship authorization is for the business. It's not for an individual, right? It's for the business that is licensed. And so the licensed tattoo artists that are working there, they're already fully licensed and approved, would all be supervisors? Is that
No, the apprentice would be assigned to one
one?
supervisor. Correct.
Okay.
Correct. And it will be
Yes.
a permit for the apprentice,
Okay.
not for the establishment.
Okay.
So the goal here is, so we require 2 years of experience before they can practice in Reading, but we're
Yep.
not providing a way for them to get the 2 years of experience within the town of Reading. So most people that practice over here, they get their 2 years from a different municipality to be able to practice over here. So what we're looking at doing is having them be able to get the 2 years here, and if they choose to stay in Reading, they can. If they choose to go somewhere else, they can do that.
Right. Yeah, I guess I'm conflating two pieces of the conversation, because I thought there was some discussion about that, but because it's a value for the business. So, but anyways, yeah, okay. I agree with Rick's suggestion about requiring the reading of the regulations. And I don't have any other comments or questions about the material.
Gary, do you have any comments? Or looks good to you?
Yep, looks good.
Just one more thing. I've done a thorough review of the regulation, and it looks like this wouldn't be the end of the amendment. It looks like we're going to be coming back because most places now allow microblading, and we don't allow that in the town of Reading yet. But it looks like we have an establishment that's already doing it without being permitted to do it. So it appears that I will be amending that regulation again to include microblading. And also there are some details about piercing operations that are missing in the regulation. So this won't be the end of the amendments. This is just the beginning, pretty much.
And is this going to be part of section 23 or another section?
It will be another section.
The apprentice will be another section.
Correct.
What is microblading?
I was afraid to ask.
Permanent makeup.
Permanent makeup.
It's usually eyebrow. Yeah, it's kind of like I'm not sure of the distinction, but it's kind of like a tattoo.
Pretty much.
Yeah. I was trying to figure out how it's different, but that's another conversation for another day. So I'm not sure yet. We'll learn more about it when we amend the regulations with your guidance, Ajay.
Yeah, it's more of a permanent makeup that doesn't go off. It doesn't come off.
Right. Exactly. Very current.
So I think so I think we're all set in terms of that one addition, and otherwise it can go to town council. Okay.
All right, sounds good. Thank you very much.
You.
And Kevin, you're right on time. We're rolling through the agenda at lightning speed.
Oh, great. Yeah, sorry for my tardiness. It was the Coolidge Middle School open house night, and Madison was playing with their friends. So it was a little tune concert.
Oh, that's nice.
Yeah,
Great.
one plays the sax and she plays the clarinet. So had to make it down there.
Oh,
Sure.
absolutely.
Any updates on the coalition that you wanted to proffer?
Sure, you really are rolling through it, huh? Wow.
There we are.
What do you people must be Celtics fans. Is that what's going on here?
It hasn't even come up.
Yeah. Okay. So I did want to just bring up really just one thing. A lot of the stuff is kind of ongoing that we've talked about in the past. There wasn't really much new to bring up there. But I did get to meet Tanya, who is the new public safety clinician. And the correct pronunciation of her name is Jaranecki. The Z is silent, I found out. But she is excellent. I really feel like we got a good hiree here. She has a high motor. You know, you're almost going to have to reel her back a little bit. You know, she's one of those types. She jumped in right away. I told you last time, she's taking over the CIT program, which is the crisis intervention team, and adding to it with her first month. So it used to just include follow-ups. Now she's also doing house calls through the CIT program as well. So really, you know, personal one-on-one kind of follow-ups, which is great. So that was to me really the biggest updates. There were a lot of things that I was going to tell you about, but our meeting got moved, and these things have all happened now, so it not really applicable. But they are doing a lot of outreach. They had a table at the Burbank YMCA Healthy Kids Day on April 30th. They also were going to have join with Winchester Coalition for hosting an author on May 3rd, which in regards to mental health. And there was a Family for Depression Awareness event on May 10th for postpartum depression and maternal mental health. So there's a lot of outreach going on with the coalition, which is great. And like I said, the biggest addition is having Tanya. And I think she's already hit the ground running. Just going to be excellent for the town.
It's great to hear. Great. Okay, a day monthly report.
All right. Before I proceed with the monthly report, I would like to acknowledge the presence of Jackie McCarthy. She is the new member of the Select Board, and she is our new liaison to the Select Board.
Welcome, Jackie.
Thank you.
Jackie.
Congratulations.
Thank you very much. Nice to see you all. I look forward to working with you. And Carlo Bacci will also be liaison, continue to be liaison to the board. So yeah, thanks.
Great.
All right. So in terms of the monthly report, in the month of March, we conducted 1 solid waste inspection and 3 housing complaint inspections. With the COVID-19 trends, let's see. Unfortunately, Kristen is not here tonight. She's not able to join us, but I'll go ahead and give the updates on the COVID transmission. Let's see. Since the beginning of COVID-19, we've had a total case count of 5,083. We've had 53 deaths in the town of Reading, and we've had 4,920 recovered cases. Within the past week, we've had 93 active cases, COVID-19 cases. We've had 4 influenza cases, 2 Lyme disease cases, 1 campylobacteriosis case, and a potential COVID cluster at a home-operated daycare. With COVID-19 cases and wastewater data once again taken up, the good news is that a second booster has been approved, and we're waiting to see if the CDC will approve boosters for ages 5 to 11 tonight. FDA already did a couple of days ago, so that's great news. Treatment for COVID. Go ahead.
Can I just mention one thing in terms of COVID?
Yes.
You know, I have been tracking the mass.gov data on average 7-day average of daily cases per 100,000. And I can just show you this is the most recent This is up to last Thursday. And, if we go back to last September, it was pretty low. And then we had that spike. And the value for last Thursday was 27 cases per 100,000. It's ticking up, and it's sort of comparable. It's comparable to around December, the first week or two in December. And so, just so we know, how this compares to the surge last winter. Of course, a lot of things are different. It's a different variant. More people are boosted and second boosted, and more children are vaccinated, and testing is widespread. So I just sort of put that out there. So if you want to compare to where we were when you hear about 97 cases, that's where we are.
Absolutely.
Thank you, Rick.
Thank you very much. And
Kerry?
Yeah, just if I may, I mean, we look at this in the hospitals. I'll say the hospital data. The admissions are going up. There's a distinction made between those who are admitted for COVID and those who are admitted and then tested upon admission because they need to be and discovered to have COVID. But those COVID admissions do continue. So I guess this, as we compare to where we were in December, I think it's important to note that, and to note that things are better, but we're not done, and that there are still reasons for people to practice hygiene, to practice some safety, to consider what their underlying conditions or comorbidities might be, and to remain aware. I know we had a number of cases that popped up through town meeting. I got notified that I had been exposed. There were some cases. Fortunately, I was negative. Fortunately, so I mean, I think it's just as we gather, we do need to be aware of that there continue to be risks and concerns.
Absolutely. Okay, Dave.
also, the treatment of COVID-19 is now widely available.
Yes.
Residents can get treated as long as once they test, they inform their primary care physician, who can recommend them for a treatment within 5 days. So again, I would like to use this opportunity to remind our residents that the use of monoclonal antibodies and antiviral medications is not a substitute for vaccination against COVID-19. Everyone is still encouraged to get vaccinated as soon as they can, whether it's the first, second, or booster dose. We encourage that. Our next vaccination clinic is scheduled for May 20th at the Coolidge Middle School from 2 p.m. to 4 p.m. And I don't know what the outcome of tonight's CDC decision would be, but if they go ahead and approve it, Vaccinate RX, they're ready. They're ready to give the vaccinations to kids ages 5 to 11. In terms of our food inspection software, we've been able to finalize the procurement, and the setup is not complete. We have started using the software for inspections. We'll give you updates as we keep using the software, but for right now, we haven't seen any major issues with the software so far. In terms of vacancies within the department, the full-time public health nurse vacancy has been reposted. We've had a few interviews, and we're hopeful that we will hire a suitable candidate very soon. We're still working with HR to compose a job description for the admin assistant position. Once completed, we'll have the vacancy posted, and hopefully we will have somebody hired by July 5th, 2022. The town website was upgraded on March 23rd. We've worked diligently to design and build up the health department's website. And lately, we added a web page for kids interested in healthy activities. Whenever you have a chance, you can take a look. We're open to suggestions. Even if you want to, we're open to criticism as well. So just let us know what you think, and we'll make amendments if needed. The Reading Friends and Family Day, we're registered to participate. It's hosted by the Reading Lions Club. It is scheduled to take place on Saturday, June 11th, 2022 from 10:30 a.m. to 3 p.m. So our goal is to use this opportunity to connect with Reading families and also share vital public health information. So I'm not sure if this has been done before. Like, have we participated in this event in the past? Does anybody know?
Yeah, we have.
Oh, okay.
Usually participate in this in Town Day in September.
Okay, sounds good. Let's see. We are collaborating with neighboring municipalities to secure the Public Health Excellence Grant for shared services. The grant application has been finalized and submitted. We haven't received a decision yet, but we're hopeful that it will get approved. Once I get a decision, I will update the board. There is a select board meeting scheduled for May 31st, and I have been asked to present a summary of the health department review conducted by MAPC at that meeting. The presentation is designed to serve as a prelude to the discussion on one of the recommendations that will require the action of the select board. At the completion of my presentation, it is my understanding that the select board may or may not move to discuss the recommendation to increase the Board of Health from a 3-membered board to a 5-membered board. I welcome your presence as a board and your participation at this meeting as well.
On that point, by the way, Jackie, I don't know if you can send the board members, when you know what the agenda schedule is for the select board and the time, a Zoom, invitation so that we know when to appear.
I can ask Caitlin to include you on that.
Okay, great, thank you.
Thank you.
So pretty much I will be giving the presentation,
right,
on behalf of the board, but feel free to jump in if you need to.
Color commentary, yes.
Sounds good. All right, in March, we received a notice of non-renewal of weights and measures contract from the Division of Standards. And as a result, the Board of Health is now required to assume the responsibility of performing weight and measures functions for the town of Reading. Fidel and I have been able to interview a couple of candidates, and Fidel was able to officially appoint somebody to conduct weights and measures functions for our municipality. We currently have a $6,000 budget line item for weights and measures functions that we pay the state annually per contract. This will be discontinued at the end of fiscal year 2022. So June 30th, we will no longer pay the state. And starting July 1st, 2022, which is the beginning of fiscal year 23, the newly appointed sealer will take over weights and measures functions for the town. He will be a part-time employee reporting directly to the health director. We have been able to order stickers, inspection books, identification, sealer's jacket, and other items needed to perform his duties. And I will keep the board updated as we go. Let's see. Also, we received a public health grant from the state in the amount of $19,642. This grant is for the sole purpose of assisting the town of Reading in our efforts to enhance COVID-19 response. So pretty much they want us to use this fund for COVID-19 response, such as vaccination efforts, testing efforts, case investigations, and contact tracing. The sad news is that it's for FY22, meaning that we have to spend the money by June 30th. And that is a challenge because we're so fortunate in this municipality to have the backing of the finance committee and the select board, and they've been able to give us the resources, the financial resources that we need to address COVID. So it will be a challenge to find something to spend the money on in less than 7 or 8 weeks, in less than 7 weeks. So if you have any suggestions or ideas, please let me know. The only other option will be to return the funds.
Right.
Okay, that's not an option. Carrie, you got some, go ahead.
I was just curious. I mean, I am familiar with what you describe today, the challenge and the spending, but are test kits in good supply in our community? I have found in other areas where I work that the opportunity to augment this health department supply of test kits has been very much appreciated. Just curious.
Correct. We have more than enough at this point. We had an ICS meeting a couple of weeks back, and the goal of that meeting was to deploy test kits to town buildings and departments that can give the residents easy access.
Okay.
And town clerk's office has gone through like almost 10 boxes, which is equivalent to like 930 test kits. The library has gone through 7 to 8 boxes. So, I mean, people have access to these test kits, and we still have a huge supply of test kits.
Okay, we've had, I asked because, sorry, Kev, just, I only asked because folks that had a good supply, like you, had kind of distributed and wanted to have some in abeyance, but it sounds like that's not a similar issue here. So, other thoughts, I'll think about it. I'm sure Kevin has a good idea.
Well, I don't have a good idea yet. I need more information. That's a so Ade, did they give like a specific list, or is there some gray area in there? Tell me.
No, yeah, they didn't really give any gray area.
Okay.
They just wanted for COVID response.
That's their only criteria?
Correct. Vaccination efforts.
We can spend that money. Oh yeah, we can spend that money. I'll get my thinking cap on. If they're leaving gray area, we'll get it spent.
I mean, the last resort will be to order more test kits, you know,
Right.
rather than give the money back.
Well,
Right, but that's
to me,
not.
COVID response is that term is a very wide term. I could argue, you know, COVID response could be even things as simple as potentially bonuses for our public safety employees that had to work into these crazy conditions, right, over the last 2 years and what they've had to go through. That probably won't fly, but I mean, when they're going to give gray area, I'd like to try to think on this one a little bit and try to wiggle the box around a little bit.
Well, we attended a webinar, and they said that you could use it to pay salaries of nurses or people that are actively involved in COVID response.
Great.
So, that's in line with what you just mentioned.
Okay.
Carrie?
2 questions. Remind me, who is the department that issued this?
DPH.
Right, I'm sorry, which unit from DPH? Was it through OPM? Was it through Office of Local and Regional Health? Was it through Bureau of Infectious Disease?
I can take a look.
Yeah, because they'll have different requirements. And then, so I think that there's generally we can't supplant with any of these funds, so it would have to be additional hours for salaries. That's something to clarify. Supplanting is generally a big no, regardless of how flexible the offerings are. So that would be good to clarify.
It doesn't state it on here. It just
That's
says
okay.
Department of Public Health. So.
Yeah, that's okay.
All right, so 6 weeks.
Yeah.
Okay.
Yep. We'll follow up. Sounds like Kevin will too.
It's a great thing we're meeting on June 2nd. So.
That's right.
Oh, that's right, yeah.
Yeah. And let's see, Jen has been really busy. She's been going for trainings and conferences. So if you want to shed some light on that, Jen, please do.
Sure. I was at the most recent MHOA conference regarding quarries, sorries. We did some recreational camps because we do have 2 in the town of Reading, as well as beaches. We don't have any of those, but it was interesting to hear their take on the beaches and the lakes, and swimming pools. So we've got some swimming pools coming up. So that was a good day. Also took the CPO certified pool operator training. That course is completed, as well as the Food Code Pro. So I jumped in immediately with the Food Code Pro training and get those inspections done. And the reports are beautiful. I'd love to save one so I can send you a copy so you can see how they're turning out, because they look fantastic.
That's great.
All right, so that concludes the monthly report.
Great.
I have a question.
Sure.
Have we talked about, there was a, and I'm forgetting the term, that's why I'm holding my head, but we had talked about moving an inspection with all of our different restaurants to, it needs-based, that's not the right term, but I'm just curious if there's been any, further work on that, or, what you might be able to tell us about that. And tell me what the right word is, sorry.
So I think, yeah, you're referring to a risk-based inspection.
Thank you, yes.
Okay. All right. So, we just started. We've not even been through the first round of inspections yet. So what, I talked about with Jennifer was for us to go through the first round of inspections, see how things are in the town of Reading, and then we go from there. So we just need to get a feel of how things are going, and what restaurants do what, and who are the dirty restaurant, the unsanitary restaurants in Reading, and what restaurants are clean, things like that. We just have to categorize them and then go from there. But we have to do the first round of these inspections first before we do that.
Absolutely. Thank you.
Thank you.
I just wanted to mention, since Jennifer got her certificate, that I got my certificate for Foundations of Local Public Health Practice. Completed 35 hours, and but it really doesn't, there's quite a few. It was a real eye-opener for me in terms of the broad spectrum, the breadth of public health, the details involved, and gave me a very good understanding. And so I would encourage everyone, meaning you can do it at your pace, and each lesson is about, I don't know what it's supposed to be, but it would usually take me about 30 minutes, maybe 35 minutes, depending. And each lesson starts with a pre-test, and then you go through several slides, and then there's a post-test. And there's about 27 lessons you have to work your way through. But it's definitely, it was one of the recommendations of MAPC for board members. And so no pressure, but it's going to be out there. And it's something you may want to definitely consider when you have some downtime. Yes, Kevin.
Carrie, you sent us this in an email, right?
I did.
Okay, that's, I just wanted to make sure I have it still. Good.
Yeah, if I can just add, Rick, it was a recommendation by MAPC because they are wise, and it is included actually as a requirement in the current public health workforce standards that are under consideration. It would be shifted from a recommendation to a requirement. So, and that certainly, those haven't been approved yet, and there's lots of things that might happen in the meantime, but I think that just goes to show the value that is placed on it by leaders in the state of public health. So I'm glad you did it, Rick.
Yeah, me too.
Yeah.
Got my certificate right here.
Well done.
Well done.
It doesn't have my signature on it anymore, does it?
No, it has
Good.
someone, Ashvini Bakshi, program
Winnie,
manager.
Yep, Winnie's the new program. Good, because they were trying to figure out how to switch those up. So good. I'm glad you did that.
Right, so moving right along, I don't see any members of the public here. And just one or two things on next meetings. There's been one or two comments by residents around meeting in person versus continuing to meet remotely. And so the emergency order that allows remote meetings under the open meeting law expires currently July 15th. And, you know, who knows what's going to happen subsequent to that. It could be that the governor extends it. It could be that there's a recommendation for hybrid meetings. You know, we also don't know, as we were talking about earlier, whether, you know, the incidence of COVID will be climbing, in which case, you know, they may feel it's more prudent to allow the remote option. So certainly right now, I'm thinking we're definitely going to continue remote meetings for the June meeting and the July meeting. And then we'll have to make a decision, you know, subsequent to that, depending on what the state does. I feel like my own personal feeling is the remote meetings provide as much access to the board and its deliberations. I guess there's a sense out there that it's nice to be in person for some people. So we'll just have to see. I mean, ultimately, I would think when we finally get to normalcy, if that ever happens, we would be back to in-person meetings. At our July meeting, I talked a day about this. At our July meeting, I asked a day to present to us sort of where the department is relative to the MAPC recommendations. You know, what has been done, what is in process, and what are the things that he would recommend, you know, be worked on over the next year in sort of what time frame and what kind of accountability. So we'll have some follow-up on that at the July meeting.
I think the board will get a preview of that at the May 31st select board meeting.
Oh, okay, good. Jackie's going to think we always end this early. We never end this early, Jackie. It's usually 9 o'clock or a little
Did
bit
you
after.
folks cut some stuff off the agenda when I was gone?
We just
what am I
flew
missing?
through. It never happens.
We got 9 chickens, yeah?
The 9 chickens,
Nine
Okay.
chickens.
the 9 chickens and an extension
An
to
extension?
June 20th.
Yeah.
For,
Right.
we asked questions. I think, you know, we were well prepared.
Yes.
A day provided good information. We were well prepared, so there wasn't, you know, too much puzzling through. Oh, and yes, and the apprenticeship is going to legal counsel, and We did all our work, Kevin.
Oh, wow. Yeah, great. I mean, this is a record. I can't remember the last time we had less than an hour. It's got to be 4 or 5 years ago.
Yeah, now if we had 5 members, that would have been more difficult.
Even so, we'd be done pretty quick. Right, that's true. That is true. But, well, but anyways, okay.
Conversation for another day.
That's
I'll make a motion to adjourn.
second.
Roll call, Carrie,
Yes.
Rick, yes. Bye, everybody.
Bye.
Thank you.
Nice to
Yeah.
see
Bye,
y'all.
everybody.
Take good
Thanks for
care.
everything.
Take care.
Thank you, Ade.
Thank you.
Thank you, Ade.
Bye.
Thank you. everybody.
And
Bye.
thanks, Jackie.
Problem.